sacral range of motion. We need dorsiflexion first, plantar flexion globally. Next, going to the subtalar joint, inversion, eversion.
Note the good lockout with the midfoot with the left hand.
After that, going down to the midfoot.
And what are you looking for here?
I'm looking for the cuneiforms translating on the talus.
Wait, the cuneiforms on the talus or
The navicular on the talus.
Next, we're going down to the Liz Frank joint.
That's your cuneiform.
That's cuneiform.
On the navicular.
Next, we're looking at the first ray. Plantar flexion, dorsiflexion.
And we talked about the C. Can you describe that?
We have the C grip coming across.
And it's also not just the C grip, but it's like the C arc of motion of the first ray.
Yeah.
Right, so if we were looking at it from over your shoulder, you want to see it being able to like have a convexity to it.
Yeah. That's a good word choice.
And then if we move to the fifth,
Another convexity.
same reciprocal, like reflected C motion
Cupping and splay.
for the forefoot. First, yeah, okay. Go ahead.
Or
Go ahead.
great toe extension. Extension and plantar flexion. First met. Dorsiflexion, the first met. A limited extension. So locking out the hind foot in eversion.
So right now we're
Inversion.
assessing the oblique axis on the lateral aspect of the foot.
So subtalar inversion locks out the joints on the oblique axis. Eversion unlocks them.
And the direction of motion of the oblique axis is dorsiflexion abduction. It's not the. Yep. Lock it out. Yeah, there it is.
Yeah, so abduction would be against the midline of the foot. Yep. Second ray being that midline. And then you come to the medial side and you do the same thing. This is obviously a different axis. What axis is this?
Medial longitudinal.
And then describe what you're doing at the hind foot and what you'd expect to see at the forefoot as a reflection of that.
Inversion at the hind foot leads to limited movement across the MLA.
That's the first ray.
Across the first leg. Eversion at the hind foot leads to more motion at the first ray.
So it's a little bit more closer up to the talonavicular that you're going for here.
Okay.
So the mid-tarsal joint is where the talus meets the navicular and cuneiforms. That's the mid-tarsal joint. So you're getting a little more proximal. So you kind of get on the navicular actually and do it from there.
Well done.